Hi everyone, my name is Dr. Victoria and I want to talk a little bit about SI joint pain or sacroiliac pain. So when I encounter patients that are complaining of a sharp or even dull, achy pain sort of right in the center of their butt, and even sometimes they're feeling it down the back of their thigh, I'm thinking, okay, we've got something going on with the SI joint. And that can oftentimes be caused either something more traumatic like a fall or some kind of injury to the pelvis. It can also be something even non-traumatic like the age-related degenerative changes like arthritis or pregnancy. Throughout pregnancy, the pelvis and the body is changing just so much, so as a result that can put some strains through the SI joint. So right here on my pelvic model, so here's the front and then here's the back, so you have your spine and your sacrum and each of your kind of hip bones or your ilium. So the SI joint is right where the sacrum and the ilium are connecting, so right in through here. So you have your ligaments and you have muscles that all kind of help to support that SI joint. And oftentimes with dysfunctions, what we see is that there's some sort of asymmetries in the muscle length or muscle strength, and those need to be sort of worked out and assessed. The great thing about working with a pelvic expert therapist is that we're able to look at all the muscles that are inside and outside attaching to the pelvis, because there's a lot of muscles in your pelvic floor, and all those muscles need to be assessed and making sure that they're not pulling on the sacrum or any of the other bones of your pelvis that can cause any of that asymmetrical stress through one or even sometimes both of those joints. We oftentimes will see that both joints can be irritated through pregnancy. Sometimes people will even have like, oh, it started on the right and now I'm feeling it on the left. It'll kind of hop from one side to the other. So we'll see that too. Some quick tips that I'll usually give to the majority of patients that are having any of those problems. I'll first want to make sure that they aren't kind of standing on one leg or sitting kind of on one hip. I really want to make sure that we're doing equal weight bearing through both feet or both sit bones, so we're not doing any unnecessary kind of rotating or stressing those joints further. Going from there, we can look at activity modification. So how are you getting dressed? Are you trying to stand on one leg and hop to get your pants on? Can we do that sitting down so we're not doing, again, any of that one-sided stress and straining, trying to just keep things as equal and neutral as possible so we're just, again, not irritating that joint. From there, we end up working on a lot of soft tissue work, whether that's internally on the muscles in the pelvic floor or externally looking at the glutes, the low back. There's a lot of muscles that attach to the pelvis. So those all, again, need to be assessed. And then developing a really good core and glute routine, trying to get all of those muscles really nice and strong and supported as well.